Hello to everyone from WHO headquarters.
COVID-19 is surging in countries with lower vaccination rates in Eastern Europe, but also in countries with some of the world's highest vaccination rates in Western Europe. It's another reminder, as we have said again and again, that vaccines do not replace the need for other precautions. Vaccines reduce the risk of hospitalization, severe disease, and death, but they do not fully prevent transmission.
Here with us in a room, we have...
We continue to recommend the tailored and proportionate use of testing, masks, physical distancing, measures to prevent crowding, improve ventilation, and more. And get vaccinated when it's your turn. Every country must constantly assess its situation and adjust its approach accordingly. With the right mix of measures, it's possible for countries to find the balance between keeping transmission down and keeping their societies and economies open.
Minatan, who is our chief scientist.
No country can simply vaccinate its way out of the pandemic. It's not vaccines or, it's vaccines and. And it's not just about how many people are vaccinated, it's about who is vaccinated. It makes no sense to give boosters to healthy adults or to vaccinate children when the health workers or older people and other high-risk groups around the world are still waiting for their first dose. The exception, as we have said, is immunocompromised individuals. Countries with the highest vaccine coverage continue to stockpile more vaccines, while low-income countries continue to wait. Every day, there are 6 times more boosters administered globally than primary doses in low-income countries. This is a scandal that must stop now.
I wonder what's WHO's view?
And even in the countries, we're seeing across Europe, across the world, transmission, is increasing. Transmission is driven by so many factors right now. The variants, increases in social mixing, which began months ago. The patterns that we are seeing across Europe, the patterns we're seeing across the world are entirely predictable. Because when you lift public health and social measures, when you lift the rules around masking and distancing and improving ventilation, avoiding crowds, in the context of variants, in the context of increasing social mixing, in the context of limited vaccination, you're going to see the virus thrive. And that's exactly what's happening right now.
It's about the 2 antiviral pills.
But to have a drug potentially coming down the pipe that can treat high-risk patients earlier in the course of disease is good news. But we wait to see the meta-analysis, we wait to go through the process. WHO will work with partners to ensure, under Mariangela's leadership, that we have the safest and most efficacious products available, and then obviously trying to get to the point where they can be produced at a price that people can afford. So I think it's all going in the right direction, but we just need to move step by step in a methodical way.
Dr. Van Kerkhove, we will now call on...
And we are struggling to even maintain the most minimum of services right now on the ground. And the risks are growing, people are dying, people are starving, people are dying because of lack of access to the very basics of medical care. The very basic human right to life is now being lost. And it's an unfolding tragedy, and it's unfolding before our very eyes. And the world needs to wake up to what's happening.